Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol, as evidenced in successful studies in 2014, 2018, 2022, and current clinical trials. Today, we're coming back to the cognoscopy, Dr. Bredesen's evaluation to screen for all the potential contributors and risk factors for cognitive decline. All these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about vitamin D. Next up, we're getting into vitamin E. Okay, so how does vitamin E relate to brain health? As Dr. Bredesen says, vitamin E is an essential nutrient and an important protector of our cell membranes, a powerful antioxidant with anti-Alzheimer's effects that is exclusively obtained from the diet. Vitamin E interacts with our cells' fatty cell membranes, protecting them from damage by scavenging free radicals. It is one of the few molecules that has been shown in clinical trials as a monotherapy to slow cognitive decline in Alzheimer's disease. Imagine, when combined with a multi-pronged therapy like ReCODE, what it does. Vitamin E is critical to our cell antioxidant defense system, immune function. It helps fight off pathogens like bacteria and viruses by protecting polyunsaturated fatty acids in immune cell membranes, which are prone to oxidative damage. Vitamin E helps widen blood vessels and prevent blood from inappropriately clotting. It helps with the formation of red blood cells. It also helps the body utilize vitamin K, another important fat-soluble nutrient. And vitamin E helps with cell-to-cell interaction and communication. Studies have repeatedly shown that low vitamin E intake has been associated with higher risks of dementia. Low vitamin E levels in the blood have been associated with poor cognitive function and memory performance in older populations. And some studies have shown that Alzheimer's patients have considerably lower levels of vitamin E in their blood and cerebrospinal fluid than normal. Symptoms of vitamin E deficiency can present as neurological dysfunction like loss of feeling in the arms and legs, difficulty coordinating movements, loss of reflexes and slurred speech, muscle weakness and difficulty swallowing, vision loss, weakened immune function, nausea, diarrhea, intestinal cramps, fatigue, headache, rash, and gonadal dysfunction, degeneration of the cerebellum in the brain, white matter lesions, and psychosis. A vitamin E deficiency is no joke. Now, standard of care's normal blood lab range for vitamin E is between 5.5 to 17 micrograms per milliliter. We typically be given a clean bill of health, walking around with levels of anything above 6, 7, 8. But Dr. Bredesen doesn't want us down at these widely accepted normal and adequate levels, as they have not been shown to be neuroprotective. Dr. Bredesen's team has seen optimal and improved cognitive function in patients with a vitamin E blood lab range between 12 and 20 micrograms per milliliter. And that blood lab is the most commonly measured form of vitamin E, alpha tocopherol. To go beyond normal and get our vitamin E levels into the optimal ranges, we first need to know how deficiency can happen in the first place. Common causes for vitamin E deficiency have been not getting enough in the diet, especially if consuming a very low-fat diet, and digestive dysfunction, primarily fat malabsorption disorders like Crohn's disease, liver disease, gallbladder disease, pancreatic disease, and cystic fibrosis. Vitamin E deficiency is relatively rare in most of the population, yet when the flashlight's been taken out to take a closer look, vitamin E deficiency seems to stand out as very common in those already diagnosed with mild cognitive impairment, Alzheimer's disease, or dementia. It's kind of hard not to get enough vitamin E in our diets, so when it is deficient, it's typically a canary in the coal mine. It could be a sign that the body is not absorbing dietary fat appropriately, which spells out a lot of trouble for the body and the brain. Healthy fats are crucial for the integrity of all our cell membranes, and the fattiest organ in our body is the brain. We're talking about an organ comprised of over 60% fat. We've got fat malabsorption and vitamin E deficiency. We're most likely having issues, if not already deficient, in the other essential fat-soluble nutrients, vitamin D, K, and A. So these digestive disorders need to be identified and treated and essential nutrients replenished. Please check out episode 27 for Dr. Bredesen's recommendations on healing the gut and improving digestive function. And also check out episode 16 for Dr. Bredesen's anti-Alzheimer's diet to cover all our nutritional bases. The current recommended daily intake for vitamin E is 15 milligrams a day. And the highest vitamin E concentrations can be found in foods like sunflower seeds, almonds, pine nuts and peanuts, avocados, spinach, Swiss chard, broccoli, Atlantic salmon, trout, olive oil, and wheat germ oil. Because digestive dysfunction has become more prevalent and the average nutritional value of our food supply has also diminished, if vitamin E blood levels are suboptimal, Dr. Bredesen recommends supplementing with E in its best absorbed and whole form of mixed tocopherols and tocotrienols, vitamin E. So, to recap, Dr. Bredesen's optimal vitamin E blood lab range, measured as alpha tocopherol, is 12 to 20 micrograms per milliliter. Now, this is a fat-soluble vitamin that can build up in tissues if too much is taken. So definitely consult with your medical practitioner and test levels often to see where you're at. And I'd love to hear from you. Has your neurologist ever spoken to you about vitamin E levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful to you and your family, and see you in the next video. Thanks.